Hello, and welcome to another episode of Under the Magnifying Glass, where we're talking about immune health supplements, which are dietary supplements, sometimes referred to as immune boosters. This topic is likely on everyone's mind as we are in the midst of a cold and flu season. Have you been considering stocking up on products, hoping they might safeguard you and your family against wintertime colds, coughs, body aches, or other symptoms no one wants to experience, or perhaps even re experience? My name is Cindy Crawford, and I am a senior research associate with the Henry Jackson Foundation in support of the Consortium for Health and Military Performance, or CHAMP. CHAMP is a defense center of excellence located at the Uniformed Services University. I support a program called Operation Supplement Safety and conduct research to identify trusted evidence for helping healthcare providers and consumers make informed decisions. If you're just tuning in for the first time, make sure to check out our previous episodes where we talk through the evidence surrounding some of these dietary supplement products and ingredients. In this episode, we'll discuss why it's important to consider the science of immune health supplements from the perspective of whole person health and resilience outcomes. So, with us today, I have the pleasure of speaking with Dr. Helene Langevin from the National Center for Complementary and Integrative Health and Dr. Laverne Brown from the Office of Dietary Supplements, both located at the National Institutes of Health. Join us as we take a look under the magnifying glass at immune health supplements and discuss key tips about these supplements that can help you to make informed decisions. So let's start with some introductions. Dr. Langevin, how are you? Please introduce yourself.
Hello, I'm Hélène Langevin. I'm the director of the National Center for Complementary and Integrative Health at the NIH. And as both a researcher and also somebody who used to work as a clinician caring for patients, I saw firsthand the challenges that patients face in achieving good health and why they often seek out complementary and integrative approaches, including natural products like dietary supplements, plant-based products, and probiotics. And I'm really excited to be here and discuss what we know and how it fits into our understanding of whole person health.
Thank you so much for joining us today, Dr. Langevin, and thank you for your contributions as an expert panelist in our research project, where we explored the evidence surrounding dietary supplements for immune health within a context of resilience outcomes. So, Dr. Brown, would you please introduce yourself?
Hello, Cindy and Dr. Lajram. My name is Laverne Brown, and I direct the Resilience Research Program at the National Institutes of Health Office of Dietary Supplements. As you know, the science of resilience is one of my favorite topics, and I always appreciate opportunities to break down some of the nuances of understanding resilience outcomes, especially when it comes to making choices about dietary supplements.
Thank you, Dr. Brown. Thank you both for being here. So, whole person health and resilience frameworks, they seem like very complex concepts. Before we dive on in to break down these concepts, I have to mention our disclaimers. So, what we'll talk about today are our own opinions and do not reflect the official policies or positions of the Uniformed Services University, the U.S. Department of Defense, the National Institutes of Health, or the Henry Jackson Foundation. And any mention of trade names, commercial products, or organizations does not imply endorsement by the US government. Okay, so let's jump right in. I'm anxious to get a better understanding of the concept of whole person health. Dr. Langevin, please help us to understand this concept and why it might be important when considering immune health dietary supplements.
Thank you, and I appreciate the chance to discuss whole person health. Internalizing this concept can transform our approach to health. From research to healthcare delivery, our system is often geared to view people through the prisms of specific body parts or specific conditions, like different diseases, for example, instead of the whole person. But in reality, our health reflects what's happening among multiple interacting organs and systems. and across interconnected domains like biological, behavioral, social, and environmental. So we often think of our health in a linear way, right? Impacted by singular problems and singular solutions, like cause and effect, like a row of dominoes. But our health is much more like a spider web, where negative or positive health factors reverberate across the entirety of the whole person. So, the pervasive thinking about supplements is a really good example of why we often miss the mark in managing our health. It's common for people to identify a health need or a problem and look into a supplement to fix it, right? In reality, we may be putting too many expectations onto what any single supplement can do, even when there is some evidence behind it, and overlook numerous other factors that may impact that health issue. If taking a supplement for a given health issue is where the solution seeking starts and stops, that person may not experience the maximum benefit. Without looking at the whole person, people may be setting themselves up for continued struggle. For something as complex and as the immune response, it's important to recognize the different factors at play and how they all come together and impact your body's ability to ward off illnesses and recover. Broadly, research tells us that poor quality sleep, chronic stress, poor diet, sedentary lifestyle, poor mental health, and environmental exposures can all negatively impact our ability to fend off illnesses. For example, research has shown that cardiovascular exercise can improve the vaccine-related immune response for people who were previously sedentary. Other kinds of research tells us that for older adults struggling with loneliness, mindfulness-based stress reduction can actually create a detectable boost in immune biomarkers. And gut bacteria and probiotics have also been shown to play a role in modulating our immune systems. The complexity of immunity illustrates why so much of NCCIH's research focuses on multi-component interventions, or more simply, taking multiple different approaches to promoting better health, rather than evaluating what a single approach, like taking a supplement, can achieve in isolation.
Thank you, Dr. Langevin. This is really helpful information. But I'm wondering, what role does resilience have in all of this? Dr. Brown, you mentioned that you would break down the nuances of understanding resilience outcomes. Please explain.
Sure, Cindy. An understanding of resilience is key to our ability to determine whether a factor, like the environment, a person's diet, or even a dietary supplement, can actually strengthen an individual's likelihood of recovering better, or adapting, or resisting disruption upon exposure to a stressor. Stressors such as sleep deprivation, extreme exercise, or even exposure to common viruses. So, simply put, understanding or discovering resilience outcomes is very different from measuring disease outcomes. And this is an important nuance since by law, dietary supplements are not allowed to be marketed to cure, mitigate, treat, diagnose, or even prevent any disease or condition.
So, Dr. Brown, do you mean that claims like natural flu shot, boost immunity and keep you healthy from disease, resist infection, or any claim mentioning COVID are considered disease claims and are not permitted by FDA regulations for dietary supplements?
Yes, Cindy, that's correct. And for this reason, we assess the available scientific information on immune health supplements strictly through the lens of resilience outcomes. I invite the listeners to check out some of our educational materials on the OPS, NCCIH, and ODS websites, as well as our recent publication on a November issue of the journal called Nutrients, where we detail the evidence that was discovered. In general, when we're considering whether or not to choose an immune health supplement, we should ask ourselves what health benefits do we expect to gain from using this supplement? And then we should ask ourselves what, if any, evidence is available with respect to resilience outcomes for that particular supplement.
Thank you, Dr. Brown. And of course, let's not forget those factors or evidence relevant to whole person health, when considering immune health supplements. Dr. Langevin, are there any helpful tips you'd like to share?
Well, I really appreciate this discussion about resilience because it's an essential part of understanding whole person health. There are some things that we know and that can help individuals make good decisions about supporting their immune systems. First, I have three big picture takeaways and three takeaways specifically about supplements for immune health. First, the big picture. Number one, natural does not always mean safe, especially when it comes to interactions between other supplements or prescribed medicines. So talk to a trusted healthcare provider. Number two, be very wary if a supplement maker is working to make you believe a single product is the solution to a problem. Dietary supplements are a multi-billion-dollar industry. Aggressive marketing and over-promising is a persistent problem, and the Federal Trade Commission is already taking action on manufacturers who run afoul of the health claim rules. Number three, don't overlook common sense. Our immune system is a natural disease fighter. We can support our system through good daily nutrition, sleep, exercise, and stress reduction. And we also know, based on available research, there is no better trainer for our immune system than vaccines. Vaccines teach our immune system to recognize a dangerous invader and help strengthen the natural defenses we're born with. But there isn't a vaccine for everything, including colds. So here are three practical takeaways about supplements and immune health. Number one, there's supplements, not substitutes. So make sure your diet is good and that the foods you eat are delivering your recommended dietary allowances. If you know through testing and discussions with your healthcare provider that you're deficient in certain areas, look at dietary changes and possibly supplementation. Evidence can support the use of certain dietary supplements in certain situations, like zinc, echinacea, or vitamin C. But generally, there's only modest evidence that supplementation is really going to impact your immune health. Number two, recognize the risks of overdoing it. There can be too much of a good thing, and some products like zinc can cause health problems when overused. Number three, use reliable resources to inform the decisions you make. Individuals can cut through the noise of marketing promises and get the real deal about natural products that are often sought as immune boosters, like vitamin D, C, zinc, echinacea, probiotics, and more. Along with the information available through ODS, NCCIH offers great resources on our website, including our A to Z Topics Guide, Herbs at a Glance, and a very special resource called Know the Science, which helps people separate fact from fiction. There are clearly many unanswered questions and so much more research to be done to better understand the complex array of factors that impact our immune health and the role of dietary supplements, even something as basic as understanding how much our bodies need every day. But as research continues, I encourage individuals to take the time to learn more about the multiple factors that can impact the health issue you're concerned about, whether that's your immune system or any other health issue. That broader, more holistic mindset can help you ask questions and seek out resources that help you build your health toolbox to not just address a specific problem, but to help improve your overall resilience across the entire spectrum of health.
Thank you both. This has been a great discussion, and I hope we can continue these discussions about whole person health and resilience within the context of addressing the research gaps that currently exist surrounding dietary supplements. People are taking control of their own health and see self-care as important now more than ever before, and so attending to these issues is key. For those listening in, make sure to know that there are resources available to turn to for information. You can visit Operation Supplement Safety, as well as NIH's Office of Dietary Supplements and National Center for Complementary and Integrative Health websites for evidence-based information about dietary supplements, whole person health and whole person health approaches, as well as resilience. And of course, please feel free to send any comments or questions through our Ask the Expert portal on ops.org. That's OPS as in Sam, S as in Sam.org. Thank you for tuning into Under the Magnifying Glass.